Welcome to the Nursing Post podcast, All Nursing All the Time with Ashley Moore and Rosa Horsley. In this episode, we discuss the challenges in healthcare and for the LBGTQ community as well as those in healthcare. Our goal is always to inform and start conversation.
The LGBTQ plus communities have faced an overwhelming bias along with discrimination and prejudice. For a community that practices inclusivity, it's unfortunate that the community at large does not include them. And this is from everyday life to healthcare. As healthcare professionals, we promise to do no harm. And with this episode, we hope to encourage open-mindedness and inclusivity.
So we did find a couple of statistics because, we love numbers. More than 175 anti-LGBTQ plus healthcare laws were proposed in 32 states around the United States in 2016. More than 50% of LBGTQ plus people experience healthcare discrimination. 1 in 5 trans people has been denied healthcare coverage simply because of their trans status. LBGTQ plus youth represent up to 40% of all young people experiencing homelessness. LBGTQ plus youth and young adults have a 120% higher risk of experiencing homelessness. 29% of transgender people reported that a healthcare provider refused to see them due to their sexual orientation or gender identity.
It's really sad. I didn't realize that those numbers were that high.
I didn't realize that they were this high either. Me being naive.
Well, yeah, I will say there was a lot of things that I'm like, really?
When you get into medicine, whether you're a nurse or you're a doctor, you just feel like regardless of whom is in front of you, it's your job to make them well, period.
Right.
So, yeah, did I know discrimination? Did I know disparities? Of course. I think last year, we keep saying this all the time, I think last year was the year of an epiphany.
Right.
Like the light bulb moment came on and everything. I just didn't realize, this particular population of people seem to have it worse than a lot.
Yes. I wanted to go over some terminology. And this is not an exclusive list of LGBTQ terminology by far. If we understand what they mean, then we'll be able to have a basic conversation with somebody.
Just better understanding.
Right.
Yeah.
So LGBTQ stands for lesbian, gay, bisexual, transgender, and queer or questioning. That Q can go either way. And the plus, it just means anything and everything after that. This is more for the United States. In other areas, I think it's like an LGBTQI. And then there's letters that are being added, but y'all, I just can't keep adding letters. I feel like we're almost discriminating by putting them in this separate group. They just need to be treated like everybody else. But anyways, that's what it stands for. Asexual means someone who experiences little or no sexual attraction, no matter what your gender is. Bisexual is someone who is attracted to both sexes. Androgynosis or androgyne is someone who presents as neither male or female. Cisgender or cis is somebody whose identity matches the gender that they were assigned at birth. So this is like, I don't know, 90% of the population, however large it is. Like, I was born with a vagina and I feel like I'm a female, so this would be me.
Yeah. So, I learned something new.
Yes. Gender nonconforming is someone whose gender identity and or expressions do not conform to the cultural or social expectations. Now, within this gender nonconforming category, there are other things. And this is the stuff that I'm starting to hear more of, especially on social media. And, my old ass is having to Google this because I don't know what it means, to be quite honest. I'm like, what does that mean? So
you're not alone.
Like, what does this stuff mean? Agender is someone who has little or no personal connection with gender at all. So kind of like asexual.
I was about to say that's
sex,
almost
agender,
the same thing.
Right.
Yeah.
Bigender is someone who identifies as both male and females. Gender fluid is when gender when gender identity and or expression varies over time. So I guess sometimes they feel more masculine, sometimes more feminine. It literally is fluid.
Flowing.
Yes. Gender queer or a third gender is someone whose gender identity or expression falls between or outside of the male or female expectations. Intergender is when somebody's identity is between genders or a combination of both. Pangender is when your identity is composed of all or many gender identities or expressions. So that's the male, female, or this third gender, essentially.
Mm-hmm.
I didn't even know, y'all, there was a third gender. I'm going to be honest with you.
I'm learning every day.
Intersectionality is people who find themselves at a crossroads between multiple identities. Non-binary, this is something we're hearing a lot more of. And this is when a person's identity does not conform to the gender binary of male or female. That means they don't identify as either
a
one.
Man or a woman,
right,
regardless of the genitalia.
Correct. Pansexual is someone who is attracted to people of all genders. So it's more about the person than the male female. Transgender is someone whose gender identity differs from the one that was assigned to them at birth. A transsexual is someone who has undergone or wishes to undergo gender affirmation surgery. So this is somebody who is male, who actually identifies as female, who has surgery to change their genitalia. And the last thing I want to talk about is pronouns. We're hearing a lot of, what's your pronoun? My husband was like, what do they mean by that? He didn't understand this whole pronoun thing. And I was like,
well, if they're non-binary,
right, then they don't identify as she or he. So it will be them, they, or their. You don't go off of he, she, him, her, his. So it gets a little confusing.
It does.
And so now I'm like, well, damn, what are you supposed to say? Like,
just their name.
Well, like if somebody does something nice and I don't know who they are, I may say, thank you, ma'am, or excuse me, mister.
I understand.
To be polite, because that's how I was raised.
Yes.
I was raised in a Southern home, and I was raised with respect to elders, and
just people.
And that was
general.
part of it.
Yeah.
There are certain manners, I guess, that are not as common as they used to be, and that's a manner that I grew up with, and that I was expected to conform to. Like, that was, you don't be rude to your elders.
Yeah, that was the standard. Like, you open the door for the elderly. Like, that was the standard in my day.
Exactly. Same thing. So I'm like, oh man, now if I'm like, thank you, and I say the wrong thing, are they going to be mad? And, me being me, I thought about it for about 3 seconds and then was like, oh well. If they're taking what I am giving as a compliment offensively, then that's for them to work out with between them and that person. But
I can see that.
I'm just like, I mean, they could say, well, no, I'm a mister. And I'd be like, oh, I'm sorry. And then
correct it. Yeah.
And then I'm done. But if they're like totally offended by it, then that's something they got to work out with themselves. So yes, it's a lot.
It is a lot. And I am proud to say that I do know most of these. When you started getting into the a, bi, gender, a, bi, fluid, inter, and all that, I'm not that woke.
Yeah, that when we were looking at the gender non-conforming type of categories, it gets a little hazy for me.
Everything else, all the terminology, I guess because I'm not too old,
right?
I know a lot of it. And I mean, you've heard me say this all the time. Love is love. I don't care where you get it, how you get it, as long as you're not hurting the children or hurting anybody else. I'm all for it.
Well, absolutely.
So just be aware that this list is not exclusive to the LBGTQ plus terminology, and that these terms, I've heard commonly, you've probably heard them, but you should also understand the meaning so that you can be educated and provide the best care for your patient or support, a loved one.
Yes. One of the big topics that I think we want to talk about today is discrimination or disparities, and how this affects healthcare, because that's kind of what the podcast is about.
Yeah.
Anybody, any person that is in this community pretty much is discriminated against in some way. We have tried to go through and hit what the different groups may go through and how it can affect their health care. And there's even, of course, some statistics thrown in here because
we love numbers.
We love numbers. And, you know, that's kind of how you back it up, you know, when you
with facts.
With facts.
Yeah.
So, Rosa, do you want to start out with?
Sure. Gay and bisexual men are at an increased risk for STIs like chlamydia, syphilis, and gonorrhea, and make up more than half of our HIV/AIDS population in the United States. MSM have a higher risk of anal cancer associated with HPV as well. MSM who have HPV and HIV are at greater risk for HPV results in anal cancer, and 95% of MSM have HPV compared to 59% of MSW. Lesbian women are less likely to have cancer screenings like mammogram or pap smears. That's alarming.
Mm-hmm.
Lesbian women were significantly less likely to have health insurance coverage and a wellness visit within the past year, which is also alarming. They also reported unmet medical needs and were less likely to have had a recent mammogram or pap test. Lesbian and bisexual women are more likely to be overweight or obese. Eating disorders, body image, reasons for exercising, and perceptions about the value and meaning of weight control. And I mean, I can see that, but I can see that not just in this demographic or population.
Mm-hmm.
I mean, a lot of people have this issue.
They do. But lesbian and bisexual women are at a higher risk of this over top of the population who's already
at risk. Wow. Lesbian, gay, and bisexuals are more likely to become disabled at a younger age than heterosexual individuals. A study suggests that disparities in chronic health conditions, health risk behaviors, and poor physical and mental health among LBG adults could be adding to the increase of disability.
Mm-hmm.
There are higher rates of mental health conditions. The LGB adults are more than 2 times as likely to experience a mental health condition. Transgender individuals are nearly 4 times as likely to have a mental health condition or hopelessness. And think about that.
Mm-hmm.
Even if you're not LBGTQ plus, just being a teenager
is hard.
Mm-hmm. And then trying to navigate the world of being a teenager on top of your sexuality is hard. And then on top of that, trying to be labeled or place a label or identify just makes it even harder.
Well, and you also have to think about these children who have to come out, and they have to constantly do that to their parents, to their friends, to their teachers, to their like they're in a constant state of telling people that they're different. And some have to wait until they're adults to do this because they just can't.
The fear of rejection
is real. I mean, and that plays a huge mental role. And then so many of the LGBTQ youth are homeless. I mean, we talked about those statistics at the beginning of it. It is awful to think that part of that is because they're not welcome home.
They're not
because
accepted
of their sexual orientation.
Correct.
It's just really sad. I mean, it really is. I couldn't imagine as a mother telling my child that they weren't welcome back in the home because of this. I just couldn't imagine. I remember having a conversation with my daughter. I asked her, and we were talking about boys, and she's like, yeah, I don't like boys. And so I was like, huh, okay. I was like, you don't like any boys? No. And she turned up her nose. And so I legit just straight out said, well, do you like girls? And she's like, oh, Mom, no, I don't like girls. I like boys. I just don't like any of the boys at school. And I was like, oh, okay, that's fine. You know, but I wonder how many other parents would openly ask
I have.
their children that. Like,
My
'cause
daughter, I
I'm
have.
just like, well, hold on. Maybe.
It's not going to make me love my child any less.
It wouldn't.
I guarantee
So
you
I just
1,000%.
don't understand. Like, it saddens my heart to think of that. It really does.
It does. Transgender youth face even more disparities. They are twice as likely to experience depressive symptoms, seriously consider suicide, and even attempt suicide compared to a cisgender lesbian, gay, bisexual, queer, and questioning youth. 40% of the LBGT adults have experienced rejection from a family member after coming out. And 86% of LGBTQ youth reported being harassed or assaulted at school. LBGTQ are at increased rates of anxiety, suicide, and substance or alcohol abuse. The substance abuse is a type of coping mechanism or a method of self-medicating. You just want to numb yourself.
Yeah, absolutely.
If you're consistently feeling rejected, like you don't fit, you're out of place, you're carrying this huge dark secret, because maybe your family is not that accepting. Maybe they're like really strict South, Christians, and they believe in this one way, and you're having a difficult time trying to convey, express, and have conversation. Like, I can see why you would try to numb yourself.
Absolutely.
LGB are at 2 times higher risks for substance abuse. I think we've pretty much discussed why. And transgenders are at a 4 times higher risk for substance abuse.
It's awful to think about. And then on top of all of that, there are certain policies, like hospital visitation policies, where same-sex couples aren't even given the same rights as heterosexual couples, even if they live in a state that recognizes their union, which is mind-blowing to me. And on top of all of the medical disparities that Rosa just talked about, this can lead to an inability for decision making.
Mm-hmm.
So if I was married to a woman and I was her partner, I was her life partner, and we're in a place that recognizes our union, they're not necessarily going to let me make medical decisions if it was like my husband. They would be like, no, you can't make the medical decisions. So a lot of places are telling these, gay couples that they should get a power of attorney or an advance directive that names a person who would be making those medical decisions. But yeah. I'm like,
that's their legal right once they enter that marital union.
Right.
That's like, your next of kin.
You don't require that of heterosexuals, and they're actively trying to make laws to make this easier. But it's becoming an issue where people aren't getting proper care, or they don't have somebody with them. They don't have their spouse with them because of some old
school thinking
or visitation policy that hasn't been updated in a while. And the U.S. Department of Health and Human Services, this is also known as HHS, detailed guidelines for hospital visitation that is supposed to prohibit discrimination based on, quote, race, color, national origin, religion, sex, sexual orientation, gender identity, or disability.
But they are being discriminated
against. But they're
against.
Still being discriminated against. And so that's kind of frustrating. I mean, that's frustrating for me. And I'm not within this community. I know people who are. And if their partner is the one that's making the decisions and their partner's the one, why do I care? I don't care. You
just want to give the best care to your patient as possible.
They know that person and they know what they want. Well, exactly. Then there you go.
That should be the bottom line.
Exactly. And so exclusions of transgender and healthcare in private and public healthcare plans is also causing some issues, because then transgender patients are going to seek medical treatment options through illegal channels. And that's never safe.
No, absolutely not.
There's no way to argue that that's not safe. So there has to be some conversation about that. I mean, there are certain things that are considered elective procedures. There are certain things that are considered non-elective procedures. And this is within healthcare, no matter what your gender and things are. You know, maybe that stuff can get sorted out on the back end. You know, if transitioning yourself from a woman to a man or a man to a woman, you know, is considered something that should be paid for by healthcare plans or not. I'm not going to have that discussion because I haven't done enough research on that to know if that's something that should be considered an optional surgery, an elective surgery, or if that's something that's detrimental to their health. I can't answer that.
I know it's a process.
I mean,
I know you have to go to counseling for so long to make sure you're mentally prepared. You have to live your life for like so many months under that identity, like the whole 9 yards before, you know, a surgeon will even consider.
Right. But, you know, like I said, I'm not well versed enough to even speak on that. I think I've taken care of one transgender patient in the 11, 12 years that I've been a nurse, and didn't need to see them below the waist. And so I don't know what they had attached to them. And it does not matter.
It doesn't.
Because it did not make a difference in what I was doing for the care that I was providing at that time. Does it matter for certain things? It absolutely does.
It does.
Because there are things that you're at higher risk for, whether you're a male or female. And we know that. Changing it physically on the outside is not going to change that. But it does make a difference. So I don't want people to be so close-minded to say, well, it doesn't make a difference. Well, yeah, it does. I don't have a prostate. But if I was born a man and I've had everything changed and I'm a female now and everything says I'm a female, and then I start exhibiting signs of prostate cancer, nobody knows to look for my prostate.
Yeah, that's a problem.
That's a problem.
And this is one of the challenges, you know,
yes,
of healthcare.
Right.
And I think maybe that's why it's not really discussed as much as it is.
Right.
And we need to talk about it.
Absolutely. But all you need is some medical professionals.
Correct.
Some people from the community that can represent and explain things, because don't be so self-absorbed to think you know everything, because at that point we're not going to go anywhere.
Absolutely.
With that person. So it's about opening those doors and having conversations, which I think we'll talk a little bit about here in just a minute. But the last thing I wanted to touch base on was that this community is at risk also for heart disease, more so than the average person. Because there's a lot of people who are at risk for heart disease.
Yeah, this is just one more thing to add.
About.
Yeah.
You know, for the sexual minority men, this is typically due to tobacco use, illegal drugs, and poor mental health. And for the sexually minority women, it's due to tobacco use, alcohol consumption, illegal drugs, poor mental health, and their elevated BMIs. So there's things that this community is having to deal with on top of just blatantly, a lot of them are discriminated against.
Exist.
Yeah, just to exist. I remember this one guy, I worked with his mother. I knew he was gay. I didn't know if she knew he was gay or not. I mean, he was like very flamboyant. So it's kind of one of those, how'd you miss that, Mom? But whatever. I didn't know, so I never said anything because I'm not sticking my foot in my mouth, and it's not my place.
No.
And I remember her saying something to me one time. She laughed at me, and she said, "You know, I know he's gay, right?" And I didn't say a word. I just looked at her. She said, "Well, I'd have to be deaf, dumb, and blind to not know." And you know, I'm just kind of chuckling. I'm sitting there. I remember I was standing in front of the treatment cart. I remember it very vividly because it was very traumatic for me, and I didn't have anything to do with it. And I'm just like, oh no, I'm not getting in this conversation. And evidently around puberty is when this really transitioned for him. And she said, you know, looking back, it's kind of he's always been this way. And somebody literally painted faggot across the road in front of their house when he was, I think he was 14 or 15. It was so bad that they had to get somebody from the state to come out and like do the road, like put down, like, I don't know if they did like asphalt or whatever over top of it, because they had painted in front of his house.
Yeah.
And this was probably 10 years ago. No, it's probably been 15 years ago. So we're looking at from that time, about 20 years ago, 25 years ago. And I mean, it's just sad.
It is sad
that in the late 90s, early 2000s, that was an issue, but it was a really big issue. And it was very traumatic for him. And
I can
imagine if the neighbors didn't know. Now everybody's got
knows.
this, big old thing in front of their yard. On the street, in front of their yard. Yeah, and it really made him more timid. It changed his personality. She was telling me about how it really influenced him. And it was just sad that on top of being a teenager that you have to deal with these external issues.
It is sad because it's one of this demographic and population. They're one of the most inclusive. Like, they want to include you in everything. They have so much love to give. They're so friendly. They're so nice. They just want everybody to be happy. Just, love one another, respect one another. All they are asking for is equality. That's all that any of us in this life really want, is equality.
Right. It's really not a lot to ask for.
No, and respect. It's really not. That's all. That's what every person wants, regardless of their heritage, their race, their religion, their identity. Like, all we want is to be respected as human beings and individuals, period, and loved. That's what makes us different than animals.
This explains a lot why some people really aren't any better than animals.
I agree with that.
But I do think that there is starting to be a movement of change that is hopefully going to, work itself out. And I think one of the big issues is, where do you start? Because there's so many issues that all need to happen. But I think
it starts at home.
Well, I think that people just need to do something. Even if it's not the right starting place, just by doing something, you're moving in the right direction. And I think we get so caught up on, like, within our government, like, okay, where do you start? How do we start making these changes so that these disparities are no longer existing in our healthcare system for the LGBT community? Like, just start somewhere. Just pick a spot and go. If it's not the right spot, you can change it later.
I agree. I mean, I agree with what you're saying. And I do think there has been some progress. I don't think there's been enough. Like, you can turn on the TV right now and, I can tell you 20, 30 years ago, you would not see, a gay couple on television, or, a gay couple with an adopted child on television. Almost any show that you turn and watch to now, has included that. Yes. Because that's what's becoming everyday life.
Well, you need to, even if you don't necessarily agree, say, I don't agree with that. That's okay.
It's okay to disagree respectfully. It's okay,
but there's no reason to be disrespectful. Correct. And there's no reason that they shouldn't be treated like a person.
I mean, the fact that we're having this conversation in 2021 is kind of crazy. The fact that there was a big hoopla and much to do about a commercial on the Hallmark Channel because, it was like an LGBTQ commercial, and families were upset because that commercial aired, that they pulled it off. Well, I'm upset that you didn't pull off every other commercial that showed, like, heterosexual couples in commercials. You know what I'm saying? Like, I thought we were past that. I thought we were getting past that.
No, I don't think a lot of people are past it. I just think that maybe some people are just quiet about it.
Well, you know how I feel about teaching tolerance instead of acceptance.
Right. Well, I think that's exactly what's happening. I just tell my kids, I remember I was watching HGTV and there was this gay couple. They were buying a house together. And my son looked at me. He said, "Are they husband and husband?" I said, "Yes." He goes, "Okay." He starts watching TV again. He turns around. He goes, "Well, are they wife and wife?" "Yes." And he just looked and he's like, "Okay." And you can see the wheels turning in his head, but I mean, the answer is yes. There doesn't have to be another explanation for your child when they're young. But I don't want him to go out into the world and be like, oh, what is this?
Yeah, like he's seen an elephant with polka dots or something.
Yeah, no.
No. Like I said, it starts at home.
It does. I think some of the things that we could do to improve it is to have a dedicated office within the government that is run by the LGBTQ community to help with improving access.
I agree. This is my philosophy on a lot of things in life.
Mm-hmm.
If you want to know how to fix something, shouldn't you go to the people and ask the people
who it's affecting?
Yes. Yes.
Mm-hmm.
Like if I have a problem with my car, shouldn't I take it to a mechanic to tell me what the problem with my car is?
Yep.
So why wouldn't we have a committee with LGBTQ plus board members?
Right.
I mean, to me, that's common sense.
To me as well. I think that they'll have to look at changing or improving insurance accessibility so that people aren't seeking inappropriate care elsewhere.
Or no care at all.
Or having trouble finding someone that will take care of them, like a lot of the trans community is having. I think we need to fix the curriculum. I think there was maybe a sentence or two about the LGBTQ community in my nursing program.
I think there was probably the same in mine. And to be quite frank, I would probably say that it was pretty biased.
Mine wasn't. It was
closed-minded bias.
Mine was more you treat the patient that's in front of you and that's it. And you're not to judge them. You're just there to take care of them. And I'm like, well, as I become a nurse, and I think we so many times say, oh, don't judge this person, don't judge that person. Mm-hmm. That's exactly what nurses do all day long, is judge people.
Yeah, we assess and judge.
So I would say is, yes, you need to judge. If you pick up a vibe that a person is gay, or if you have a question about their sexual orientation or gender identity, maybe you just need to ask.
Politely.
Yeah, there's a way that you can ask. I mean, you're in the medical field. We ask all different kinds of questions.
And we've heard all kinds of different things.
Yes. So to ask a very simple question like that should really be...
if it's appropriate.
Yes. But that's where you have to kind of fill out that situation. Yeah. That's where you are constantly judging. I think we're using that word. It's frowned upon so much. It's like it's a negative thing. But there's a positive thing about that too.
I see that.
So I think that we have to kind of rethink.
You do have to judge the situation and use your common sense.
Yes. To make the most appropriate
decision.
Yes, exactly.
Well, I think we need to create a nurturing environment that is inclusive. You know how I feel about inclusivity, period.
Yes.
I think I've mentioned a lot of how I feel through a lot of these episodes and podcasts that we've done. The problem is people like to put labels on stuff.
Oh, yeah.
And so when you put labels on stuff, it starts to segregate.
Yes.
So when you stop putting labels on stuff, then there's less to separate.
Yeah, that's why I get kind of like the whole LGBTQ+. I'm like, it's a community of people that are different. But they're still people. And I feel like that sometimes pulls away from their individuality. It just puts them in this community.
Yeah, you're just putting labels is just putting something in a box.
Yes, and it doesn't fix anything.
And in 2021, we need to start thinking outside of the box.
Exactly.
We need to help with disclosure of sexual orientation and gender identity while being aware that this is a sensitive and very personal process. Use your common sense. You know, if you're treating somebody for the common cold or flu, who cares?
Right. Not relevant.
It's not relevant to that situation at all. Now, like you mentioned, if somebody's having prostate issues, prostate cancer, and they were born male, but they're in front of you as a female, and you're trying to figure out why, you know, this lab work isn't, you know, matching up, by all means, ask.
Right. Well, just like men don't get breast cancer as much as women do.
But they do.
They do get it.
Yeah.
But it's not as common. So maybe if you were a woman and now you're a man, the doctor's not thinking to look for breast cancer because it's so rare. and the likelihood of you having that, when you hear hooves, you think horse,
Mm-hmm.
not zebra.
Yeah.
So their first thought isn't going to be breast cancer, as with if you were a woman, it very well may have been.
Absolutely.
So there are reasons why it's important, and reasons why you need to have a trusted healthcare worker that you can have these conversations with, who understand all that.
Mm-hmm. And definitely encourage community involvement and advocacy.
Yes.
Like, we're so big on being advocates for our patients. Like, that's our job.
Yes.
As nurses, that's what we're supposed to do.
Mm-hmm.
We're supposed to advocate for our patient. When a doctor's prescribing the wrong dose, it's your job to say,
hey,
hold your horses, dude. Like,
are you sure about this?
Are you sure you want to give this much heparin? Like, do you realize that you're giving this much of whatever?
Mm-hmm.
Like, it's the same thing for any other patient. Like, are you sure you want to do that? Take a moment, step back, reflect on yourself. Because as we've mentioned in previous podcasts, sometimes the own healthcare worker themselves don't realize that they have a bias.
Oh, absolutely. And that's why I think bringing some of the disparities to the forefront, like, hey, these are some specific things that each one of these individuals have had a problem with, whether it's because you're gay or lesbian. I mean, maybe, if you go back to, the first thing that you had talked about with the men who have sex with men are at a higher risk for gonorrhea, syphilis, and what it was the other one, I can't remember now.
I think it was HPV.
HPV. That maybe we need to be making sure that if we have a patient who is a young gay male, that we're really educating on the use of condoms. Because look at these numbers, sir. Look at these numbers. There's a 95% chance you're going to end up with HPV, and HPV can turn into anal cancer. And not only that,
we've discussed this in the past.
You can talk about
even
the HIV.
with women.
Right.
It can turn into throat cancer. It can turn into anal cancer. It does
Cervical
not discriminate.
Cancer. Right.
Yeah.
And so if you tell a young gentleman, hey, it's fine that you're gay, not really concerned about that, more concerned about this,
the practices,
and explain to them what risks are involved, well, then maybe they'll understand, hey, they're not judging me. They're giving me the information I need to make good healthcare decisions about myself, since 95% of gay men have HPV. And where can that lead to? We're trying to be preventative here. And there's a vaccine for HPV now. So
it doesn't treat all the strands.
It doesn't treat all the strands. And there are different strands that affect gay men versus like your typical heterosexual male or female. However, having those talks and educating yourself is what you need to do. I never got the HPV vaccine. You probably didn't either because of our age.
But my children did.
My children have as well. I'm not sure. When did they start?
Both of my children have had it.
No, I know my daughter has. I'm not sure about my son.
He might be too young. I think they start at 11 or 12.
I think he might be.
He might be due one.
Yes. We'll find out when he goes for his appointment.
Yeah.
But that's kind of one of those things that this is where educating and having those open conversations. But healthcare workers are really going to have to initiate a lot of this stuff.
Well, times are changing. We had an episode about what our population and demographic is going to look like in nursing homes within the next 10 to 20 years.
Oh, it's going to be completely different
than what it is now. We're not going to be with baby boomers. We're going to be people that have, HIV, STDs, not STIs, because those go away, but STDs.
Yes.
And what that means for healthcare. And so, every decade or so, it's going to keep changing. And the demographic of people is going to keep changing. And then the more people that we're seeing, the more open we have to be about it. So education is important.
It really is. You can find our references on our website, thenursingpostpodcast.com, and subscribe to our podcast on your favorite platform. Be sure to leave us your thoughts and comments, and we would love to have any information that you guys have on the LGBTQ plus community that we can help spread awareness. Thanks again for listening to The Nursing Post.